This week we will be looking at Chapter 22, Assessment and Anxiety Disorders. We will begin by talking about abnormal psychology. There are three different ways to decide what abnormal behavior is. The first one is a statistical frequency approach. Considered abnormal if it only occurs rarely or infrequently in relation to the behaviors of the general population. A more optimal way of understanding the statistical frequency approach is to look at the bell curve. When we look at the mean of the bell curve, which is the center darker blue bar under the column C, anything that is considered normal behavior would fall into this range. And as we move further and further to the left or the right would be considered abnormal behavior. And this is how we would determine, according to the general population, what is normal behavior and when it begins to become abnormal behavior. And that would be in the area of the lighter blue to the left or the right in the D or the B column. And as you move away from the center, then the behavior becomes more abnormal. If you look far to the left, which is the F column, and far to the right, which is the A column, they would be considered outliers. This would be extreme abnormal behavior in either direction. Again, keeping in mind the bell curve, social norms would be in that mean bar, which was the center of the bell curve. Social norms are considered behaviors that deviate from what society sees as normal. So therefore, if you deviate from the center, this is what again is making behavior considered more socially abnormal. Maladaptive is behavior that is damaging if it interferes with a person's ability to function. So keeping in mind the bell curve, you can be not in that means bar, and it's what society would consider maybe abnormal behavior. However, it doesn't affect the way that the person lives. It might be a little quirky, a little strange, but it really doesn't affect the quality of the person's life. It doesn't interfere with their ability to function. However, at some point, the behavior becomes abnormal, moving further away from the center of the bell curve in either direction, which then creates interference with a person's ability to function normally. The third way we can determine abnormal behavior is through biology, which is nature. There could be genetic issues involved in the abnormal behavior. Learned versus unlearned behaviors could also contribute. A learned behavior would be someone that is terrified of bugs to the point that they have a phobia. And that learned behavior could have come from their mother being afraid of bugs. Genetically, they cannot control the chemistry of their brain, as, say, just like mom having blue eyes. They cannot control the color eyes that they're given. That would completely be biology. So when someone's view of the world is completely distorted, it can come from their brain structure or their brain chemistry. So think about this question. How does our brain change our perception? The third way we can decide what is abnormal behavior is through cognitive emotional behavioral factors, which is nurture. We learn how to respond to emotional stimuli. For example, when you're thrown into a swimming pool to swim and you sink and then you need to be rescued, You can develop a phobia about water. This is a stress reaction. Panic and anxiety is a learned stress reaction. Environmental factors can also contribute. This messes up brain chemistry. For example, drugs, alcohol, and food or sugar addiction. So now let's take a look at this chart and pull it all together, everything that we've discussed up to this point. In evaluating someone with mental disorders, we take into consideration the emotional factors, behavioral factors, the environmental factors, and the cognitive factors. And bringing all these pieces of a person's life into perspective and evaluating them helps us determine if there is in fact a mental disorder. Bringing all these factors together is called an assessment. It is how we recognize disorders. Recognizing disorders is done in a systematic evaluation. The assessor will bring together the psychology, biology, and the social environment of the person, and all that contributes to that. This is how we make up the biopsychosocial model. For the assessment, an evaluation in neurological testing can be done. At this time, they would be checking for brain damage, brain malfunction using MRI or fMRI scans. An fMRI scan actually measures brain function. They would be checking for possible tumors, diseases, or infections of the brain. Next would be a clinical interview. This is where the assessor would gather information, the patient's past and current situations, their beliefs, their attitudes, their emotions, any problems that may be going on for them in their lives. The third aspect of the assessment would be psychological test. This helps the assessor determine how you perceive your environment. They're like personality tests, ink blot tests, objective tests that are done in self-reporting questionnaires. The first mental disorder that we're going to discuss is generalized anxiety disorder, or GAD. Generalized anxiety disorder is characterized by excessive or unrealistic worry about almost everything, or feeling that something bad is about to happen. These anxious feelings occur on a majority of days for a period of at least 6 months. 5% of adults have GAD, and twice as many women as men report GAD. Symptoms of GAD can be irritable, difficulty in concentrating, being unable to control one's worries, which is out of proportion to the actual event. There can be restlessness, easily fatigued, sweating, flushing, pounding heart, insomnia, headaches, muscle tension, or aches. Symptoms can cause significant distress or impaired function in social and occupational areas. Going again back to the bell curve, you can have a few of these symptoms, maybe not all of them, and it is more abnormal behavior when it is impairing your function to be able to socialize, to be out and about and doing your normal everyday functions. When GAD becomes to that point, you are now looking at, on the bell curve, it being more to the left, more to the right. Many people experience, as they said, 5% of women actually report experiencing these symptoms more than men. And it's just to the level of how these symptoms affect their daily lives. And obviously, if there are women reporting to the doctor that they are experiencing these, then they must be significant enough for them to be looking for relief. treatment for GAD is psychotherapy. That would be the first course of action. And then medication. The list of medications here: benzodiazepines work by slowing down the central nervous system. Remember, the central nervous system involves your brain and your spinal cord. The downside can be that they are very addictive and can interfere with learning new material. Doctors also use antidepressants, which are not as addictive. They are not addictive. 50 to 60% of patients can be cured within 6 months to a year with either psychotherapy or medication. The next anxiety disorder we will talk about is panic disorder. Panic disorder is characterized by recurring and unexpected panic attacks. The person becomes so worried about having another attack that it interferes with normal psychological functioning. A panic attack is a period of intense fear or discomfort in which 4 or more of the following symptoms are present: pounding heart, sweating, trembling, shortness of breath, feelings of choking, chest pain, nausea, feeling dizzy, and a fear of losing control or a fear of dying. Here are some facts about panic disorder. 4% of adults suffer from panic disorder. Women are 2 to 3 times more likely to report it. You can have an increased risk of alcohol and other drug abuse, and an increased incidence of suicide, decreased social functioning, and less marital happiness. Again, treatment is benzodiazepines, antidepressants, psychotherapy. The most effective is a combination of counseling and meds. 30 to 50% of patients can be symptom-free after 1 year. Agoraphobia is another type of anxiety disorder, and it's characterized by anxiety about being in places or situations from which escape might be difficult or embarrassing, such as being in tunnels, on bridges, or in crowds of people, or on public transportation, if a panic attack were to occur or panic-like symptoms. The next anxiety disorder we will look at is obsessive-compulsive disorder. This consists of obsessions which are persistent, recurring, irrational thoughts, impulses, or images that a person is unable to control. The result is compulsive behavior, which are irresistible impulses to perform over and over some senseless behavior or ritual, like hand washing, counting, or checking. It interferes with normal functioning, and these behaviors reduce the feeling of anxiousness, but only for a short period of time. It's shown to have a genetic component. The treatment for obsessive-compulsive disorder is exposure therapy, which involves gradually exposing the person to the actual anxiety-producing situation or objects that he or she is attempting to avoid, and continuing the exposure treatments until the anxiety decreases. Most effective treatment in long term. Antidepressants reduce the urge to engage in compulsive behavior. However, only 1/3 of OCD patients are not helped by antidepressants at all. Some doctors find that prescribing antidepressants first can help persuade an OCD patient to try exposure therapy. Stomatiform disorders are marked by a pattern of recurring, multiple, and significant bodily symptoms, which is stomatic, that extend over several years. The bodily symptoms can be pain, vomiting, paralysis, blindness, and are not under voluntary control, have no known physical causes, and are believed to be caused by psychological factors. Women 5 times more likely to report it than men. The last anxiety disorder we will look at is conversion disorder. It refers to changing anxiety or emotional distress into real physical, motor, sensory, or neurological symptoms, such as headaches, nausea, dizziness, loss of sensation, or paralysis, for which there is no organic or physical cause. Usually associated with depression, concerns about health, or occurrence of stressful situations. Researchers have found that people with medically unexplained paralysis have shown that the emotional centers in their brains are activated inappropriately and may impair the functioning of the motor cortex. Easier to express physical complaints than emotional complaints is one reason for the disorder.